Hello, everybody. So good to see you. Happy New Year. I'm so glad you made it. I just hope that this year will be just much more glorious than 2004. Thank you for all your support. And I'll come again with another interesting topic: diabetes, the silent killer. And I'm happy to say that in 2004, I was made a professor of clinical chemistry and immunology. So please stay tuned and listen to this very interesting topic. So, like I said, we're going to be doing something very interesting. Diabetes, the silent killer. And I remained Dr. Iya Ezebasi. All right. I really want to shock you and give you something to think about. In 2021, the International Diabetes Federation predicted that about 522 million people will have diabetes by the year 2030. But do you know what? We are not even halfway to 2030. And as at 2022, the data from WHO said that about 830 million people worldwide have diabetes. That is really, really, really something to worry about and something to think about. So this year, I want us to think about taking care of our health a lot because this is an explosion, Pandora's box that is just waiting to happen. All right. I just want to say also thank you to all my viewers, 2004. In fact, each and every one of you has an award of excellence. And I want to please say in 2005, don't forget to subscribe, like, comment, share this video. It's free, remember. Please share it and keep our channel going on. Thank you so much. All right. So, are you always hungry and thirsty? Are you always urinating frequently, especially at night? Are you easily tired and your vision is blurred? Have you lost weight unintentionally? That's weight that you do not understand how you lost it. Do sugar ants think that your urine is the best thing that has happened to them? If you have all these symptoms, I just want to say you need to check yourself because you may be diabetic. That's just the truth. You can't move away from that. So why are we so worried about diabetes? That's because the complications that are with diabetes are very, very serious. And they include you could have a heart attack, you have a cardiac arrest, you have a stroke, you could have kidney failure, you could go blind, you may lose limb. Yes, this is true. I've seen it with my own eyes. I've experienced this from a close member of the family. It's very true. So, why are we so bothered about diabetes? What is this diabetes? Diabetes is actually a disorder that happens over a long period of time. And it usually goes with high blood sugar or high blood glucose due to either lack of insulin secretion, the pancreas are not working, they can't secrete insulin, or your pancreas are working, but the insulin secreted cannot work, or both your pancreas not working or the insulin is not working. All right. So we have about 830 million people worldwide as of 2022 having diabetes, and most of these people live in low and middle income countries. And more than half of these people do not receive treatment. Can imagine what is going to happen by the year 2025. That is a catastrophe that is waiting to happen, a pregnancy that is waiting to be. And we don't want to see that. We want to stop that as much as possible. All right. So Nigeria is known in sub-Saharan Africa to have the highest number of people living with diabetes, and the type 2 diabetes is the most predominant in this country, accounting for more than 90% of the total cases. And within this majority, there are millions of people who are diabetic and they don't even know that they are diabetic. Some know that they are diabetic and they are not being treated in the right way because of going to some other kinds of places to be able to get treatment. And they wait until it's actually too late, which is why we have a lot of morbidity and mortality. So, do you know why diabetes is a silent killer? We call it a silent killer because it's a non-communicable disease rather, which takes a long period of time. Hidden, codedly, according to Nigerian language, codedly happens a long period of time. And you may not even see symptoms until you have full-blown late-stage diabetes with complications. And you know, the funny thing is that most of the people who find out that they are diabetic usually find out because they went to check for something else, not because they know that they are diabetic. They went to check for something else. And during the course of running tests, the doctors find out that they are diabetic. And if this diabetes stays a long time, it stays untreated, you will have the high glucose levels spoiling a lot of things, damaging a lot of body tissues and organs, which could also lead to the person's death. Even if the person does not die, the quality of life that the person will live will be so low that the person sometimes will even prefer to die than to live the kind of life that he has to live. So, what are the risk factors for diabetes? If you're African, wow, you are at high risk for diabetes. If you have a family history like me, my grandparents on both sides were diabetics. My parents, my mother, my father is diabetic, so I do have a very strong family history of diabetes. The older you get, the more probable it is that you would have diabetes, especially the type 2 type. And then if you have high blood pressure, gestational diabetes, obesity, you're physically inactive, or you have a dietary lifestyle that encourages diabetes, yes, you could have it. So how can we keep this at bay? You need to maintain an optimal body weight. Sorry for us who don't know how to do exercise. God, please, I'm asking you this 2025, help me. You have to be physically active. Avoid any form of tobacco use because smoking increases the risk of cardiovascular diseases. If you're a foodie, you need to avoid processed foods like bread and butter. Instead, let your foodiness lead you to foods that are rich in natural carbohydrates. Make up your mind to live healthy. It is more expensive, but you could eat less and eat healthily. Eat fresh fruits and vegetables every day. Reduce the amount of sugar, carbonated drinks, saturated fats that you take. Get screened for type 2 diabetes every year. How do we diagnose diabetes? We have the fasting blood glucose. You don't eat, you go to the hospital, they take your blood and test for your sugar. We have oral glucose tolerance test. Here they kind of like volume load you with glucose, and over a period of I think 2.5 hours, you are tested, both your urine and blood, for the presence of sugar. And then we have this very nice test, hemoglobin A1C test. You know, in those days when we didn't have this particular test, when we're working in the lab, the diabetics will come 2 days or a day to clinic day. They would like behave themselves, they would eat well, and they would come, their sugars are quite low or in the normal range, and the doctors will be confused. But this is not aligning with the clinical symptoms that we are seeing until hemoglobin A1C came and the truth came out. These people were living rough lives until it was time to test. So this hemoglobin A1 test will tell you what the diabetic has been doing over the last 3 months, you know, whether they've been doing according to instructions or just having a bloody good life. All right, so random blood sugar test, also that's after you think you can do. All right, so how do we manage and treat diabetes? Well, your doctor may ask you to change some of your lifestyle, eat a healthy diet, do regular exercise, weight management, don't smoke. You will reduce the amount of alcohol and so many other things. Eat lean meat, go for white meat, and all those kinds of things. All right. You will also be given some medication. For some people, it could be insulin therapy. For some other people, it could be oral hypoglycemic agents, or it could be both. Then you will have to monitor regularly your blood glucose, and you would also need to learn about how to manage yourself during when you have diabetes, and also get support from some support groups. All right. But instead of going through all things, I think that prevention is better than cure. So get your glucose test done today and see a medical doctor for treatment. Take care of yourself. Thank you for listening. In case you're wondering, this is a Calabar delicacy. It's called seafood okra and swallow. Whenever you visit Calabar, just say me hi and we'll have lunch together. Take care and bye bye. God bless.